Hi guys, I'm Stephy Steph and this is Bobby, and together we are Between Two
We're Between Two Teams, that's right.
Shout out, we've got another special guest on today, President-elect candidate Dr. Craig Armstrong.
Happy to be here. Thank you guys.
Welcome. So we're going to jump right into it today.
All right, let's go.
We got a question for you. What does the future of the ADA look like to you?
Well, that's a great question. Thank you so much for having me, and I'm looking forward to our discussion. You know, I'm an optimist by nature, and I think the future of the ADA looks really bright.
Yeah.
We've got a lot going on. We've got an exciting new executive director. We've got FSC underway. We've got a lot going on that are going to engage our members, and I think the future looks really bright. I'm really excited about it.
Man, I love that what you're saying. You're talking about optimism. How important is optimism to kind of leading an organization?
Well, for me, optimism is the key. It's one of the keys to my entire campaign because I am an optimist by nature, and I think that with a little help from all of our friends out here, I think the best days of dentistry are ahead for ADA.
My gosh, I love that. Bobby, what do you think about that?
Well, who doesn't like to be optimistic? Yeah, actually, I struggle sometimes with that because sometimes I will look at situations and try to be a problem solver.
It helps me when you talk about optimism because it's easy, especially when you're a new dentist or a younger dentist. Sometimes you kind of get down on yourself, so it's nice to hear that positivity.
Well, I think one of the best things about the ADA, one of the biggest member values that I've gotten out of the ADA has been mentors and mentorship. That's played a big role in who I am as a dentist.
Yeah.
And I mentor a lot of young dentists, dental students, and for me, we've got to invest in that future, and that's why I'm really optimistic about the ADA and where we're going is because we've got some great leaders, like yourself included. I mean, 10 under 10 award winner.
I appreciate that.
I'm very proud. I'm a little biased because you are from Texas, but thank you for all you do. So yeah, optimism is a big thing, but mentorship I think has played a big role in my life, and I like to give back in the form of being a good mentor. So.
Man, I love that. You know, one of the things Bobby and I are always talking about is mentoring up and mentoring down. And that's kind of what you're talking about too, where we can learn things from each other. Whether you're more experienced or on the newer side of things, we have things to teach each other.
Absolutely.
Absolutely.
You know, just kind of thinking about things that are going on here at the dental hub and the SmileCon, I just was at a DEI presentation, and one of the things that I think we can do a better job of is collaboration with other dental groups, and I think that's where I'm most excited about is the opportunities that we have to bring more people to the table at the ADA. So I think it's time for us to really put our money where our mouth is. You know, we walk the walk, we talk the talk, we walk the walk. So I think that that's a big part of where we need to go with the ADA.
And is it sort of a collaborate versus compete?
Absolutely. I mean, totally respect every organization's independence, but I think we're stronger. We're all dentists at the root, right? And I think if we're going to address membership at the root,
yeah, I
got that. We're all dentists at the core, so I think we need to make sure that we're having the people's opinions at the table. And we've got tremendous opportunity here. Our membership, as you know, is a challenge for us. And we're not going to get there unless we have everybody at the table, because we're all doing the same thing. I mean, I'm sitting through the DEI lecture or presentation, and the great leaders that we're presenting, they're all saying the same thing we're saying. So let's get everybody together, and we're stronger together. So.
Oh my gosh, I love that. One of the things, Bob's an oral surgeon, I'm a periodontist, and one of the things we initially talked about in the essence of getting everyone together was colleagues, not competition.
Absolutely, I agree with that.
Yes. Yeah. Bobby, do you have a question?
You know, I do have a question. What best qualities do you bring to the table? We appreciate you being here. You're running for president-elect of the American Dental Association. Sure. What do you bring into the table?
Well, a little bit about me. One of my background is my family was a military family. My dad was in the Army. He was a sergeant. We moved every 3 years all over the world. And what that forced me to do was to be able to build consensus, because I had to learn to fit in, make friends. Every 3 years I had to start over, and that's a quality that I think really serves me well at the ADA, because as you know, a leader of this organization is going to have to build consensus. I mean, that's one of the challenges I think that you face as a leader. So I'd say that consensus building is one of the things that I bring to the table, and one of the strong strengths that I have. But one of the other things I think that, besides my optimism, I think is I have the ability, I think, to manage in a crisis. Just to give you a little background, when I was president-elect of Texas, one of the things that I had was one of my president died when I was president-elect. So I had to step up and take his term over and take mine as well. So that's happened to me twice. So I'm prepared, I do my homework, I know what the issues are, so I'm ready to step up whatever the situation is. So that's another quality that I've got.
I mean, I like how you talked about consensus. I think that's where your experience probably comes in the most, is because there's something, we were just talking about this, there's having ideas and then there's being effective. And we are so much more powerful when we can have a group of individuals have a consensus on a direction that we're going to go.
Well, when I was chair of the Council on Government Affairs, I basically inherited a council that wouldn't speak to each other. And one of the things that I'm very adamant about is I want every voice to be heard. And on that council, by the time my year was over, everybody on that council contributed to the conversation. And I think that makes us a better organization when everybody can communicate and feel like they're in a safe space to have that communication.
So important. I mean,
how do you make people feel included in the process? And to have a little bit of a longer question, because sometimes that's how I do things.
Really?
How, to make people feel inclusive, it's nice as leaders we get attention and focus here, but there's others that are not feeling so included in the process. How do you bring them in and get their input and their buy-in?
Well, I think part of the problem is there's a hesitancy on both parts to get involved. So sometimes, like I'll use the mentorship part of it for an example. A lot of times potential mentees reach out to us and we don't respond as being the potential mentor like we should. And there's a hesitation for them to even reach out because they're scared that we might not accept or want to be their mentor.
Absolutely.
And so I think as a potential mentor, we've got the responsibility to reach back out to them and ask them to come, because I know that, speaking for myself, I know that a lot of us want to be that mentor to that new dentist or to that mid-career dentist. But do they really feel that, right? Are they feeling that we want to help them? And I think that, most of us really want to do that. That we've talked about that before.
We've talked about that, and it's really tough. When you're a young dentist, you do not feel like you're almost important enough to come talk to people.
Why would I talk to that
known.
person? Right, yeah.
What do I have to offer you?
Yes.
And I want your help, and it's really tough because there's not an equal exchange there.
That's right. No, you're right.
Yeah, and I appreciate you bringing that up, because it's important to have people that are mentors that are willing to reach out to younger dentists.
Right.
I love that. Absolutely.
And I think through what we try to do with our YouTube channel is certainly try to connect. And I still think we struggle with that at many times. But what I hear you say, a lot of times people just need to reach out.
No, and I think that we've got, everybody's so busy right now. We do a big program at the dental school in Houston where we engage the second-year dental students. And a perfect example, I'll put my phone number out there for every dental student to call me personally. And one or two will do that. Yeah. And I'm like, why wouldn't you, I'm not saying I have all the answers to everything, but I want to come out to my office. I want to buy you dinner. I want to take you out, show you what the real world looks like.
Yeah.
And the hesitancy is that they don't think that we're genuine. So I think part of it, we have to make sure that we're putting out our message in a way that's received properly.
Yeah.
So
I tell my boys that all the time. All you have to do is ask. And
you're never going to get it if you don't ask, right?
Yeah. Great leaders will step up to the plate and say, yes, I'm here to help.
Absolutely. I totally agree with that. So.
Oh my gosh, I love that. And just kind of having people over. I remember I was part of my Great Expectations group, and I remember those mentors.
Well, you were there. You were at the same school. Yeah.
I mean, it was right there. And I remember they would have pizza, and they made the environment welcoming. And that was my first time since I had gotten into dental school that I was inside another office. And I'm like, okay, all right, this is a break from the classroom.
Absolutely.
This is what I needed.
No, it's great. I really, I don't know how much time we have left, but I really think that
30 seconds.
I really do appreciate what you guys are doing here, because you are giving a platform to not just the president-elect candidates, but to everyday people in the ADA. And I think that To reiterate my point, I think the best years are ahead of us. We've got some work to do.
Yeah.
But you know what? I'm not afraid of hard work. I'm ready for that. And I think that there are a lot of people in this organization that are ready to do the same thing. So,
That's
well,
perfect.
we love hearing your message. Thank you for joining us.
Thank you.
Dr. Craig
Thanks so
Armstrong.
much.
Thank you
Appreciate
so
you.
much. We hit the 10 minutes right on the